Schizophrenia is a chronic brain disorder with a worldwide prevalence of around 1%. It begins, usually in adolescence, and consists of positive symptoms such as delusions and hallucinations, negative symptoms such as a lack of drive and empathy, and cognitive symptoms such as the inability to focus and attend. In many cases, schizophrenia leads to long-term disability. Like all other mental disorders, schizophrenia is currently exclusively diagnosed by clinical interview between patient and psychiatrist in the absence of a definite neurobiology enabling and assisting blood or imaging tests. The different time courses and severity of schizophrenia cases, as well as the differential susceptibility to medication for positive symptoms, suggests a heterogeneity in the yet unknown underlying biological causes for the all-comprising clinical diagnosis of schizophrenia. We aim to characterize one subset of schizophrenia within the heterogeneity of biological causes by genetic engineering of a transgenic rat that expresses non-mutant, misassembled, human, disrupted in schizophrenia 1 protein, a phenotype that we had previously identified in a subset of post-mortem brains from patients with schizophrenia. The idea is that misassembled DISC1 impairs major signaling pathways relevant for adaptive behavior. This rat model displays various behavioral abnormalities as well as changes in neurotransmitter and neuroanatomy similar to those seen in schizophrenia subsets. We determined blood parameters that distinguished the rat model from healthy, non-transgenic control rats. We identified a network of interdependent and dysregulated genes in the blood of this rat model. When we tested the top dysregulated genes in blood samples obtained from 2 independent cohorts of patients with schizophrenia, we found that a similar dysregulated network of blood genes could be detected. After defining a critical threshold in the expression changes of the 2 top genes, around 25% of patients, thus a subset of schizophrenia, could be identified with 97% specificity. We conclude that measuring very specific expressed genes in the blood of patients can help the biological diagnosis of schizophrenia, and that the transgenic rat model that was used to identify those genes may reflect important aspects of the corresponding schizophrenia subset. In the future, this rat model may be used to develop tailored pharmacotherapies for its corresponding patient subset.